This is a side view of the bladder, the sac that stores urine, sitting on top of the prostate. A thin tube called the urethra runs straight down through the prostate to carry urine out. Watch what happens. Right now, everything is healthy. The blue tube in the middle is wide open, and you can see urine flowing down it smoothly. On the right, the flow rate is strong, about 21 milliliters per second. Here is the pink prostate wrapped snugly around the tube. The inner part, called the transition zone, is the ring of tissue that hugs the urethra most closely. Keep your eye on this zone. Now, the trouble begins. As many men age, cells in that transition zone start to multiply and pile up. This overgrowth is called benign prostatic hyperplasia. Benign meaning not cancer. Hyperplasia meaning too many cells. As the tissue grows, it presses inward on the tube like a fist, slowly closing around a straw. The urethra is being squeezed. See how the channel through the prostate is getting narrower and narrower. Because the tube is pinched, less urine can get through. Watch the flow slow to a trickle, and watch the curve on the right flatten out. The strong stream has become a weak, dribbling one. The bladder now has to push much harder to force urine past the blockage. Just like any muscle that works overtime, its wall thickens. Those raised ridges appearing on it are called trabeculae, bands of overworked muscle. Even after straining, the bladder can no longer empty all the way. Leftover urine pools at the bottom, doctors call this residual urine. A bladder that never fully empties can lead to infections and a constant urge to go. Step back and see the whole picture. The overgrown prostate is the true cause. It pinches the urethra, which weakens the stream, which forces the bladder to bulk up and hold leftover urine. One blockage, a whole chain of problems. So that is benign prostatic hyperplasia. Extra prostate cells crowd inward and squeeze the urethra shut like a fist on a straw. And that simple pinch is why an enlarged prostate blocks the flow of urine.